Good morning, it's Bill the Knee Pain Guru. Welcome to my Facebook page. And today we're going to talk about arthritis. This is going to be super simple. You guys are going to be like, no way. Arthritis. So many people have arthritis that they'll say by the time someone is 80 years old, like the Arthritis Foundation will say that by the time someone is 80 years old, 1 out of 2 people will experience arthritis or have arthritis. And if you look, do a Google search, this is a simple Google search. If you go and do a search on what is the definition of arthritis, this is fascinating to me. Arthritis is painful inflammation and stiffness of the joints. So if we're looking at the knee, you have painful inflammation and stiffness of the knee joint. Which, okay, yeah, everyone has experienced that at some point in time. But this is the fascinating piece, and back in, it was 2010 or 2011, I was married to what was she? Anesthesiologist. And I was asking her, because I would do research and then bring this information back and say, hey, you know, what do you think about this? Arthritis, knee arthritis, and this and that. And she said, all arthritis is diagnosed. And this is fascinating to me. All arthritis is diagnosed as dehydrated joint. Think about that for a moment. Arthritis diagnosed, knee arthritis, or any arthritis in the body for that matter, is diagnosed as dehydrated joint, which means the joint gets dry, like a sponge that's sitting next to your sink. It gets dried out. And then what happens is when it gets dried out, then the idea with when the joint is lubricated is that when you walk, there's no friction in the joint, so the meniscus and the cartilage and all that glides smoothly in your knee. But when you have arthritis, the joint starts to dry out, so when you walk and the knee is moving back and forth, it's starting to rub. Like the dry sponge analogy, it's starting to rub, and that rubbing irritates the nerves. When it irritates the nerves, what does the body do? It tenses up to protect itself. So that tension causes the joint to squeeze tighter, which squeezes more fluid out of the joint. So it sets up the conditions so the body or the knee becomes dehydrated. So you're thinking there, you know, hey Bill, got it. Okay, I'll drink more water to hydrate the joint. But here's the interesting piece on just drinking water. If you already have a joint that's tight, it's squeezing because it's in pain. When the joint squeezes, it's squeezing out the fluid. I drink water, the water's going to go through my body, but it hits that tight joint and it can't get inside the joint. Like if I had a sponge in my hand and I squeezed that sponge, if I tried to put that underneath the water in the sink, that's not going, the water is not going to be able to get into the sponge. I mean, it's just kind of a common sense thing. If we break down these diagnoses into a plain, simple, easy to understand, common language as to what's going on, it's like, oh, the joint's dehydrated, it's rubbing, it's painful. The more I move it, the more painful it's going to get. And from a conventional medical approach, they want to do, prescription drugs to numb the pain so you don't feel it. They'll send you to physical therapy, which it's a joint that's already squeezing tight, and you put that joint in pain more, that means it's going to hurt worse, which is going to squeeze worse, right? That's why arthritis gets progressively worse as you get older. You have shots. They want to put shots in the knee to find a solution. However, they could hit a nerve. A lot of times they're not addressing the tension in the joint itself, so what happens is it continues to perpetuate that situation. The joint is still continuing to squeeze, so whatever money you paid for cortisone shots, hyaluronic acid, rooster comb injections, stem cells, whatever that is, you're not addressing the tension pattern that was when the knee was wearing and irritating to begin with. So it sets up the conditions that you're on this slippery slope until you're old enough to have a knee replacement surgery. You're a perfect candidate. And that's a whole nother topic and discussion we're not going to cover today, but the point of what I'm saying is that the way to have a solution for this pattern of squeezing and dehydrating the joint is to create comfort in the knee, get the pressure off of the nerves. And when we do that, the joint feels safe, supported, and listened to. It relaxes. And when the joint relaxes, now the water that you're drinking can actually get into the joint to begin hydrating the joint, which is the definition of arthritis. The joint is inflamed, painful inflammation and stiffness of the joint that's diagnosed as joint dehydration. So, what's the solution to that? Solution is to begin creating comfort on a regular basis. When you create comfort, the joint relaxes. The tension is going to shift. When the tension shifts, we create more comfort in the new place. And we do that over and over and over, and what happens is now the water that we're drinking, the food that we're eating, the supplements that we're taking, any type of supplemental medical model procedure, meaning like stem cells or prolotherapy or any of those other injections, can now actually get into the joint and begin to do the work that they're meant to do in the joint. But if the joint's tight, because the joint's pain, it's not going to work. Welcome everybody. I'm Bill, the Knee Pain Guru. Please, if you have questions, type them in below. I'll be answering questions here in a little bit. Arthritis really isn't that complicated, and comfort is the key. It's the shortest distance from where you're at in pain to being out of pain. There is an option, a natural approach that doesn't involve drug shots or surgery, painful physical therapy to get yourself out of pain. I'd like to invite all of you. I'll throw a link down below, but I have a program that's starting up February 5th. It's called Quit Your Quack. It's a 6-week knee pain relief program that will basically train you, teach you how to work with your own knee to create comfort in the knee joint, set up the conditions so your knee can heal itself, and then make sure your mindset's in a good place so that you're not going to sabotage the process, because that's one of the tricky things is you get yourself out of pain, but then you kind of fall back into that loop of getting back in the pain again. Okay, total ablation of internal meniscus improve the risk of arthritis. I mean, how much time can I develop arthritis? I mean, how long can the joint dehydrate and begin to rub and wear? Diagnosis of arthritis, can take place in an instant. So the key is creating comfort. It's one of those things. If we look at it from a very logical perspective, if the knee doesn't hurt, like the definition of arthritis is painful inflammation and stiffness of the joints. You can do a Google search on this. I just did. That's what I'm reading right here. If the knee doesn't hurt, do you have arthritis? The medical model wants to create a disease out of it, which, okay, fine. That's their business model as well. And that's okay, fine. And if you want to buy into that and believe in that, that's great. However, what I'm saying is if you get the pressure off of the nerves, you create comfort in the knee, and you're moving well, do you really care what your diagnosis is? We get down to the fundamental thing of why you're watching the video is you're in pain. And if you're not in pain, then you have no reason to watch the video. You have no reason to go to your doctor. Sorry about that, dad call. Anyways, so my point being is address the pain. If there's nothing broken or torn in the knee, go to a doctor for your diagnosis. If there's nothing broken or torn, you don't have a torn meniscus, you don't have a torn ligament or something in your knee, the bone isn't broken, then the only reason you have pain is because of irritation of the nerves. Create comfort, the pain goes away, there's nothing to talk about. It's really simple. It's really simple. And the diagnoses can make things complicated. But my point being is, it doesn't have to be complicated. It could be very simple. Create comfort in the knee, get the pressure off of the nerves, set up the conditions in the body so the body could heal itself, keep your mind in check so you don't do things that are sabotaging the process, and then you wash, rinse, repeat. You do it day in and day out. And like I said, I'm going to throw a link down below this video. It's to my program. It's starting up February 5th. It's called Quit Your Quack. It's a 6-week knee pain relief program. It takes place on Facebook, so I would do videos like this. As a matter of fact, at 11 a.m. Eastern Time, I'm doing the program from January. I have a group of people. I only take 10. I limit it to 10 because, well, there's questions, and I want to make sure you get the attention that you need for your knees. There's a lot of questions. We have 2 calls per week like this. You ask questions in a thread, and I answer whatever you have going on. And basically, it helps you understand how to get your knee out of pain, how to create comfort, and get you so you can live your life. Because you don't want to be thinking about your knee all the time. It's no fun. So, any more questions, please ask them below. If you see the replay of this video and you have questions, please ask them in there. I will see those come through my feed, and I'll be happy to answer them. So I've got to wrap it up. I got to get prepared for the Quit Your Quack this January's group. So join the program. Would love to see you in there. Would love to help you with your knees. This is Bill Paravano, the Knee Pain Guru, thanking you for having knee pain so I can help you. I'm really good at it. Thanks a lot. Have a good day. Bye-bye.